Mic check 1 2. Mic check 1 2.
Welcome all. It's 3 o'clock on the 19th day of March, 2024. This is a meeting of the Uintah County Commissioners Board. We're at the large commission chambers, group room, brain cramp, sorry. We have Sherry Bolton for the prayer and Wendy Long for the Pledge of Allegiance. Amen.
Please stand and join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all very much. If you haven't, please silence your communications devices. And if you also haven't signed in on the back on your way out, please sign in so we've got a record of who was here. Okay, first order of business is going to be the approval of minutes from March 11th, 2024 work session and March 12th, 2024 special meeting, March 12th, 2024 meeting, and March 15th, 2024 canvas.
Shoo.
Mouthful.
I only had one thing, and I didn't get it sent over to you in time, but it was on the tax ID number. I honestly didn't grab it and bring it with me, but it was on the 12th commission meeting, the tax ID number that we were abating, that amount for the serial number, the last four digits. I think you had 877, and I believe it's 8778. So, okay. That was my only correction.
Any other?
No, and with that, I would make a motion to approve all of these minutes as stated.
I'll second it.
All right, I have a motion and a second. I'll call for a vote.
Aye.
Aye.
Aye. Passes. Next will be Caleb Hall, Deputy Clerk Auditor with the report of warrants.
Is that on? So good afternoon. Just if you can excuse Mike, he's on vacation this week and I'm just filling in. And so I've got the warrant register from March 14th. The total was $1,225,710. And that's checks 391,094 through 391,216. Just the highlights from it were the Ken Garf, the sheriff's trucks. So 6 of those for a total of $357,030. U-Bag, we paid $194,202. And U.S. Bank, $110,199. And then our Cigna Health premium for March was $364,727. And yeah, do you have any questions on that?
Sorry, did you say 364,727?
Yeah, I'm
Okay.
just leaving off the cents, but yep.
Okay.
So, and no claims.
Okay,
All right,
All right.
great.
thank you.
Thank you.
And
Any tax matters?
no tax. Well, yes, sorry. So I've got 2 deferrals of delinquent property taxes that I need approval on. The first serial number is 040500006 in the amount of $2,858.29. And then the other I have is serial number 030350208 for the amount of $2,260.93.
Okay. Any questions? Do we have a motion?
I'd make the motion to go ahead and approve the tax deferrals that's being presented by Caleb Hall.
I'll second.
Okay. We have a motion and a second. I'll call for a vote.
Aye.
Aye.
Aye. Passes unanimous. Thank you.
Thank you.
All right, next is Humanities Grant by Lana Fullbright. She is not here. She advised us she was not going to be here. So I will try to cover this. Okay, usually Sam Passy handles this, but Sam is no longer with us. He's moved on. So she got this, and what they do is they're a grant that goes to each community. They have to apply for it. Every other year, they go together. We have Alicia and Merity that went this year because they've never been before, to learning how to take care of our history in the museum. And this year, when they came back, they presented us with a $1,500 grant for the museum for a new exhibit. The exhibit will include the barn area and horses as transportation used in the early days of our valley. So we need to look at and approve the Humanities Grant in the amount of $1,500.
I would make that motion.
I'll second it.
Okay, motion and second. Do I have a vote?
Aye.
Aye.
Just reading. Aye.
Just a minute, I'll wake him up. Okay, thank you. All right, we have Comfort Center Fee Assistance Waiver, Michelle Stratton.
I thought we'd kind of decided the work meeting was just going to table that one.
Well, I
She
thought
wanted-
just till today.
Yeah, until today.
And
then they were gonna come back.
I was not aware of Leisha's formula, so I apologize for making the comments I did in the work session. But if the formula shows that we would contribute $500 towards this, I'm okay with making that motion today.
I'll second it.
And
Yes.
that's fine. We have a motion and a second and a vote.
Aye.
Aye. Okay. Anything further on that, Leisha? or is that
Well,
good?
I don't think it's really considered a waiver. It's
That's,
kind of,
that's not.
It's not
we're considering it, what is it you call a sponsor?
a sponsor. Yeah.
I think we sponsor it in the amount of $500. Is that correct?
One of the many.
They came in and filled out an event funding form, and they received $500 from that based on the formula and past years' donations. So,
Okay,
perfect.
great, thank
So
you.
is that, just a quick question, Mr. Chair, if I can, has that already been processed and it's ready to go
Yeah,
out?
it's they already have it.
Okay, so at this
Yeah,
point,
because
then
we
can
don't
just-
bring event funding applications to commission.
Right.
And so, but we also don't have anyone really ask us for waivers at the conference center. And so they came in and it was just, we had already issued the
Yeah.
event funding. And so we just had a discussion in the work session about well, we're giving you $500. That's part of the fee that's being waived. And
Okay,
so
I think
then
what
we-
it would be, we acknowledge they're getting $500 through the
Yes.
event,
Yep.
and their request for a waiver is denied.
yeah, that's,
Or you can just strike it from the agenda, so it doesn't look negative. You can just say it's not needed, so we're striking it from the agenda.
okay. I like that. That
Okay.
doesn't look bad for them.
Okay, the lady with the words has got that. Mr. Bill Lewis, sir.
Is it necessary to introduce myself?
Yes, sir, every
Okay.
time.
I'm Bill Lewis, along with these two gentlemen, Clayton Reimer and Carney Pace. We constitute the Friends of Buckskin Hills. We put on a yearly gun show in the convention center. First of all, let me thank the commission ahead of time, really, for your support in the past. We believe it is a worthwhile activity. It is a social as well as an economic activity. And it's a chance to get together with old friends and talk common interest. I have included for you all of the information from the previous shows as well as this last show. This year, we had 3,212 people attend. That is an increase of 347 people over last year. And in my estimation, the show was a great success. And what we're hearing from our dealers, I think I included that. Also, a little comment from some of the dealers.
Yes.
The dealers are happy. The people that we work with in there, the people coming into the show, appear to be happy. The other part of that, though, is Vernal is really a pretty good place to do these types of things because the citizens of Vernal and Uintah County are basically good people, and they're easy to work with. And the dealers and the people that come to visit us realize that, so they enjoy themselves. We had 101 tables out of 170 that were purchased or rented by out-of-area dealers. Now, I can't tell you the difference between those individuals who brought money into the area and those, or even a dollar amount. I'm just telling you that better than half of the tables that were rented out came from outside the area. So those people brought with them economic benefits along with the show itself. I don't really have much more to say other than we do things at that show that you don't normally find, except in an area of highly patriotic and highly loyal American citizens. We play the national anthem, and it always goes over very, very well. This time it was took several minutes to stop them from shouting USA, USA afterwards. And that is really gratifying. Do you have any questions of me or us?
I don't have any questions, but I was impressed at the way you lay it out, where you had so many vendors that you put some into another room, but yet you made it so it flowed and people would have to go through that room to go into the event, which I thought was really smart. Because then
Arnie.
those vendors didn't feel kind of left
Yes,
out.
yes,
So I
yes.
thought that was really, really good, and the rest of the layout was great.
We are at max. We cannot take any more tables. We are at max for that facility. If the show gets any bigger, then we just turn people away. We have no choice.
I don't know if they allow you to have more tables out in the lobby area, the
No.
foyer area. They don't?
No.
That's what I
No.
wondered, because some shows they can, and I didn't know with this one if it
Well,
had to be
what we've
contained.
done is we've reached a maximum number. That's the number of tables they have. When they borrow from across the street at Western Park, there are no more.
Okay, that's a good problem,
Excellent show, strongly appreciate it.
yeah.
The thing that I find really interesting is you provided us with basically a synopsis of what you've done since 2012, and it's never gone backwards. It's always increased every year. I think that is phenomenal. And I take out the two, I'm sitting here looking at, I'll take out the 2 COVID years.
Okay.
But it's phenomenal that we grow, and it's based on what you people do. I mean, y'all do an excellent job.
And to be all
Appreciate it.
volunteer.
Yes, yes.
That is
All
to
of
be
our- All of
commended.
our workers are volunteer workers.
And
No
it might-
one is paid on this except the dealers and the profit they make.
And it might be noted that that money is all kept within basically the shooting range. It's all
Yes.
utilized toward improving our shooting range, increasing it, and we have people from Wasatch Front that drive clear out here just to shoot at our range. That says a lot for what has been done. You gentlemen have done an outstanding job, and it's appreciated.
Thank
Quite
you.
impressive that your total expenses is only $1,489. You know what I'm saying? That's quite a feat.
Okay.
Yeah.
Anything else I can cover for you?
I just would like to know if you can bring some younger people to learn what you're doing, to continue this when you guys decide you're going to retire.
We would love to do that. The problem is, this type of activity lends itself to old geezers who are retired. And I would love to have younger shooters, younger sports people involved. As it is, our wives collectively do a tremendous amount of this work. My wife would be tickled pink if she never saw a gun show again till the end of time. But still, she persists. What you say is indeed correct. We would love to have new young blood. It lends itself only to old white hairs like us.
Well, I hope it doesn't ever go away. It's because it's a neat thing to have in our community.
Thank you. The idea is to make Uintah County, Vernal, Uintah Basin a better place. And we firmly believe in the principle, come enjoy our resources, enjoy what we have here. Spend your money, we appreciate that, but then leave. And that's exactly what happens with a gun show. Okay.
Great.
Well, it's appreciated.
Thank you.
Thank you, guys.
Thank you. All right, Kirk, you're on. TriCounty Health Annual Report.
Great, thank you. Here, I do have a little presentation. Let me hook into this really quick. And I have printed copies of this. I didn't bring them. I'm waiting on the printer, but I'll have those out in your mailboxes here in the next week or two. Still waiting on the actual physical printing.
Yep.
Is that visible?
Yes, sir.
Awesome. Let me make it full page here if I can remember how to. There we go.
You're plugged in.
So as is annually, we like to come to the county commission and report our annual report. We have obligated ourselves to do that both in our bylaws and interlocal agreement and under state law. And primarily, that's a focus on financials. So looking at our revenue, we get about, it used to be a little bit more than 50% of our revenue was through federal grants and federal contracts. And over the years, that has become a smaller portion of our budget. And we like that trend because we had become, over time, heavily reliant on federal dollars that really obligated our direction. As you know, the state of Utah stepped up a year or so ago and increased the state contribution to local health departments, which has been a huge help in freeing us up to really focus more on local priorities. And so we end up with about, sorry, I have some pop up on my screen that you can't all see, but can you still see that? There we go. We end up with about 20% of our total revenue being the state grants. We end up with about 15% being county tax contributions and about 16% being revenue from fees. So some of the services that we offer, the state legislature has essentially said we should be covering those with fees. Some of that being like septic system inspections. And then we also have some minor fees for things like immunizations and things for people who have insurance. We collect a copay, and so that's what constitutes that. On the expense side, we're also right at almost $5 million, and the bulk of our expense, as you might imagine, is our personnel. About 45% of our expenses are salaries and wages, and then about 18% of our expenses are the benefit packages that we offer to retain highly qualified staff. Outside of that, we also offer some of our state monies that are allocated to us, we pass through as local grants. And one of those will be coming up shortly, and we want to remind entities locally that might want to apply for those dollars that's available. And the primary one, the biggest one that we give out will be announced here in April, And that is a mini grant that we give out to local agencies, and it's aimed at curbing youth tobacco use and substance abuse. And any entity locally that has a plan that's based on good evidence, like that shows that it's actually effective at curbing youth use of cigarettes, tobacco, or other substances, can apply for those funds. In the past, Duchesne School District has offered a scholarship program to students working against tobacco, which is a SWAT program that we run in schools. And essentially that encourages juniors and seniors who are willing to take a stand and say they don't use substances and encourage their peers not to use substances can qualify for a grant. And there are a few things that they have to do as part of that. One of those is we asked them to go to the legislative session and talk to our local representatives. They met with Senator Winterton this year and talk about their experience in school related to vaping, tobacco use, substance abuse, to better understand things that they can do to be ambassadors for health. That's been a really good program. We're really proud of that, and I hope that that continues. But we'll be announcing those funding opportunities here in April to pass on some of that money. Are there any questions about revenue or expenses on Tri-County Health? There will be more detail in the printout version. This is kind of a high-level summary, and I encourage you to go through it. This is available on our website if you go to tricountyhealth.com. We're actually a .gov now, tricountyhealth.ut.gov, but tricountyhealth.com is easier to say, and it routes you to our .gov site. If you go to tricountyhealth.com and click on About Us, that's where we have our most recent audits. That's where we have our health improvement plans, and that is also where we have our financial summaries and our annual reports. So some of the highlights from the year, just this is, again, a very broad overview. We issued almost 3,000 birth and death certificates. We saw over 2,500 individuals for various nursing needs. The bulk of that is probably immunizations and childhood immunizations, but we also offer a lot of other clinical services around sexually transmitted diseases and around women, infants, and children's health. We inspected 911 individual entities and issued 815 permits. Now that's a very broad overview. The printed version goes into more detail, pulling out septic inspections versus restaurant inspections versus food stand inspections. But overall, that's a big bulk of our time is inspecting and making sure that either consumers of a business are protected in their health or that neighbors of a property are protected in their health. We do car seat inspections. People can come by and we will help them install car seats. We give out car seats when funding allows. We run a diabetes prevention program. We also do some Tai Chi exercising to help improve stability, particularly in some of our older adults in the community. We also do quite a bit on suicide prevention, and we offer a QPR training to local businesses to help them understand things that they can do to help prevent suicide in the workplace. And then we run our emergency preparedness program, and last year we ran 16 drills. We had multiple trainings and several exercises just to be prepared in the event of a public health emergency. We also look at one of our fundamental, most primary duties is to monitor the health status of the community and look for trends that are both positive or disturbing. We have probably on our radar 5 main areas where we have concerns locally. One is we've seen a decline in childhood immunizations, both in our locations and at participating doctors' offices. In terms of the percentage of youth that we have in the area against the percent that are getting vaccinated, we're seeing a gradual decline, which is concerning. We also have seen rates of suicide that are higher than other health departments in the state. We also have a much higher number of pregnant women who continue to smoke during pregnancy that we would like to be addressing better. We have higher rates of adult obesity than some of the areas of the state, and we have a higher teen pregnancy rate. So if we look at some of those areas, this is not a complete picture. This is just our, these are our internal numbers given, showing the number of immunizations that we provided that were not related to COVID-19. The yellow bar more represents COVID-19, but the blue bars are immunizations that we've administered. So in-house, we've seen a decline in people seeking immunizations at the health department, which would be fine if our local providers were saying that more people were getting immunized. But we've also seen a decline in our doctor's offices, and so that's a concerning trend. When we look at some of our reports, I ran several reports that compare the Tri-County area to other health departments. So we have some multi-county health departments like the Bear River Health Department, Central Health Department, and Southeast Health Department, and there are also some single county health departments like Davis County, Salt Lake, and Utah County. But when we look at some of our health indicator reports that we monitor, we do have a bigger issue related to suicide in this area per capita than the rest of the state, and that's something that we would like to continue to work toward addressing. Additionally, when you look at people who are smoking during the third trimester of pregnancy, sort of eastern Utah is a little bit of an anomaly. Us and the Southeast Health Department, we continue to see a mentality that it's okay to smoke during pregnancy, and that's something that we'd like to continue to work to address. Obesity, we technically fall into the higher quartile in the state when it comes to adults that are obese. And that's something that we'd like to continue to look at. And I do really appreciate Uintah County's efforts to improve trails and walkability in communities. That's something that we know is statistically significant when it comes to rates of obesity in communities, is the ability to walk out your door and go for a walk and feel safe. That's a high factor in contributing to reductions in those areas. And the other one is the birth rate for females aged 15 to 19. And you might wonder why that's a public health concern, but we do see that women in that age group are much more likely to experience both complications during pregnancy and to experience living in poverty after the baby is born. And so that's a marker that we monitor. And our area tends to have quite a high rate of teen pregnancy, and that's something that we continue to want to look to address. I don't mean to be a Debbie Downer and only talk about bad things. But oftentimes when you look at the statistics, it's easy to pull out anomalies, and sometimes those are good and sometimes those are bad. The areas where we really want to work and our primary goals in our health improvement plan for the next few years is to advance health access, to promote healthy living, to improve mental health and reduce drug use, specifically tobacco use and illicit drugs, to provide an excellent client experience for those that are seeking services from us, whether that's they need a septic tank, whether that's we're inspecting the restaurant, or whether that is them coming into us to get vaccinated for the flu or to get childhood immunizations, and to maintain a healthy environment. Those are our main goals, and that's where our staff continually strive. But the main reason I'm here is to answer questions or address concerns, if there are any.
I just know when I was in school, we always fought that teen pregnancy thing. It seems like we've always been one of the highest, or if the highest, in the state.
Yes.
I like to look at seeing why. I mean, why are we the highest? What is causing all of these teen pregnancies, and then address those issues? I know they've tried over the years.
Yeah.
Do you have any new ideas or anything along those lines?
No, I don't. I wish I had solutions off the top of my head for that one specifically. I think that's an area where we haven't been particularly engaged, especially the last few years with COVID. So I feel like we're we're really starting right now to work both with our school districts and with the community for ideas. And I think we'd be really open to suggestions. But what I think what you're dealing with is what I would call cultural norms, to say that it's acceptable or normal that people don't bat an eye at that at a teen pregnancy. We would love to improve community conversations. We have offered in schools through schools, I should say, it's not in schools, but we have offered a parental class. It's called, I think, off the top of my head, I think it's called Parents Talking Together. It's a class to help parents of teenagers talk about difficult subjects. I'm not sure that that has been as effective as we wanted it to be, either because we can't get the word out very well or because people just don't. It's hard to expect people to come to you to get a resource that they don't recognize they need, right? So I think we need to reimagine that and figure out a way to do a better job of helping encourage conversations around dinner tables about tough subjects. And I think that's, in my mind, often what some of these issues boil down to, whether it's teen vaping or teen pregnancy. It's the ability for those teenagers, when they're 12, 13, 14, to have honest conversations with trusted adults.
How are we doing on our drug overdoses?
It is still a huge concern. We are not the highest rate of drug overdose in the state. We were for a little while in 2021 particularly. But there are a lot of drugs out there, and there are overdoses almost every week, particularly around fentanyl. It is something that I get alerts on constantly. And again, I think that is a complicated problem. And if you find a community that has a magic bullet solution that has worked for them, please help us figure it out. But one of our successes on that front, I feel, is getting our harm reduction program and our local drug task force and our police on the same page. I know that the sheriff and I went on the radio over Christmas and talked about the fact that any person can call 911 and you won't be prosecuted if you're trying to save a life during an overdose event. And I think we want to remind the public of that at any opportunity we can. Like, if you are present in a situation where someone is overdosed on drugs, call 911. We've done a pretty good job, I think, of trying to get more people aware of the resources that are available. And one of the things that we ran into when we convened that task force was we found that some of our ER departments had outdated contact information for how to get people into treatment. And so making some new connections and getting people to be talking about what are the best resources right now, what, not the best resources 5 years ago, but who is actively in the community, where do we send people? We still have a significant need for treatment, particularly for women. We have some options for men locally, but when women are seeking treatment for addiction and addiction recovery, a lot of times we end up having to send them somewhere distant to the Wasatch Front for treatment options. We don't have a lot of options locally, and that's something I think we need to continue to work to address.
Okay. Any other questions? All right, Kirk, thank you very much.
Thank you. I appreciate the time.
Appreciate all that you're doing to better our community.
Thank you.
Okay. Ryan, the amendment to special building agreement and Utah Division Technology Services.
All right. Commissioners, Ryan Mattson with Uintah County IT. This is a pretty simple amendment to our internet agreement that we have between us and the state of Utah, Department of Technology Services. What this amendment changes is really just the way that the services are offered. The state is trying to segment their network between state employees and non-state employees. And so all this does is add a little bit of extra equipment to our network that will then have the internet run through it. It does add an additional firewall between us, and then the state has another firewall, so technically there'll be 3 firewalls between us and the internet, which is not necessarily a bad thing, although we could see just a little bit of decrease in speeds. But overall, I think that this is a good thing, and we've really enjoyed having our internet provided through the state. It's a good service that they offer to us. It will change things in this building and at the public safety complex. Public safety complex, there is still a little bit of communication going on between the state and dispatch, but it shouldn't really affect us. We'll wait to see exactly what they work out as far as all of that goes. But for now, this contract is finalized, and the costs per month do not change. $485 a month is our costs on that. So I'm just requesting signatures and approval of the amendment.
Could we get Anita off of that?
Yes, I apologize that it didn't get on work session yesterday.
I don't think she really is interested anymore. Since she's been retired how many years now?
Yeah, we can get Anita off of that one, so.
Okay. Do you have a motion?
I'd go ahead and make the motion that we go ahead and approve the special billing agreement between the Utah Division of Technology Services. That's presented by Ryan.
I'll second.
Okay. We have a motion and a second. Do we have a vote?
Aye.
Aye.
Aye. Thank you, sir. Okay, John Sturmer, Deputy County Attorney, for approval of an MOU between Uintah County and others.
Yeah, Commissioners, as you know, we have been involved in mediation with the named parties for a little while. We are still in mediation, and there's an MOU that's being proposed that will guide some additional process within that mediation. We discussed that during closed session. Because it is in mediation, the actual terms of the MOU will remain confidential, but we do need to have approval of the county commission to sign that MOU. So based off of the discussion we had in closed session, it is now presented in this meeting for formal approval and authorization of signature.
Okay, do I have a motion?
I will make the motion to approve the MOU between Uintah County, Duchesne County, Wasatch
others.
County, State of Utah, Ute Indian Tribe, and United States of America.
I'll second.
Okay, a call for a vote.
Aye.
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 Thank you, Commissioners.
Okay. Now is the time for public comment. Public comment is a time for public comment, not address. County will listen to comments made and take them into consideration. They will not be responding or answering questions. Comments made might be something the county has the power to act on, or they may not have. This is a recorded public meeting. If someone would like to make a comment, they will need to wait until the microphone is available, then come to the microphone, state their name for the record. Please be respectful, no interrupting. Wait your turn. We'll have a total of 15 minutes. We'll allow 3 minutes for each speaker. Anyone want to step forward? Okay. I see no one for public, so we'll close public comments. We have a need for a closed session?
Yes.
Okay, we have a need for a closed session for the purpose of discussing pending intimate litigation.
The small room, or just stay right here?
No, let's go to small.
Okay.
Oh, you're gonna make a motion?
Okay. I'll make the motion that we go ahead and go into closed session. We will move into the small conference room for the purpose of discussing pending or imminent litigation. And upon that time, we come out of there into regular meeting and adjourn.
I'll second.
We have a motion and a second. All in favor?
Aye.
Aye. Thank you all very much. And happy spring to all.